Hello there, I'm Dr Epie Njume. I'm a general physician working with the Cameroon Baptist Convention Health Services. I'm also the general supervisor for the Non-Communicable Disease Prevention and Control Program. I work as a clinician attending to patients on outpatient basis in our walk-in clinics for diabetes and hypertension, and I also attend to hospitalized patients. I try to keep my clinical work because it helps me to focus my activities on the program and to design them to be relevant. As a supervisor of the NCD Prevention and Control Program, I determine the strategic orientation of the program and overall supervision. I promote staff capacity upgrades. I also ensure that our program activities are clinically, scientifically, and ethically sound and in line with our goals. And I also promote engagements in partnerships which foster program goals. Through our NCD program, we have increased the knowledge on NCDs in the general population, and through our screening approaches, many more people know their risk of developing NCDs. We've had many people whose NCDs, especially diabetes, hypertension, and obesity, have been diagnosed early enough and they are on treatments, and this has prevented complications which would have otherwise already set in if the diagnosis had not been done in time and treatment started. We've also improved the quality of life of people living with NCDs through our increased or enhanced management approaches, wherein we've trained our personnel to use the current evidence-based guidelines for management, and we've also adopted or created local tools and protocols which are relevant in our setting for improving NCD care. We've also created support groups for our patients living with diabetes and hypertension. Through these support groups, the patients interact with their peers, they benefit from the experience of those who've lived with the conditions for longer periods and who are well controlled. We also offer continual individualized counseling that is targeted. So if a patient, for example, has a problem with meeting their targets for blood sugar, they will meet with our diabetes and hypertension educators who will try to find out what the problem is and counsel them adequately for that. And the counseling is ongoing, and the patients come monthly for visits to check the target and for any adjustments in their treatments if necessary. I think that the Obama Foundation Scholars Program will be an excellent opportunity for me to consolidate the achievements that I've made so far leading the program and designing various approaches, and also to be more innovative and relevant to the challenges in our setting. So I feel that I'll also be able to network and create partnerships which would help us to advance our goals for the NCD program. Thank you.